sugar off.
And then try to eat it.
He's a goat. That's what he does.
Alright, you guys. I should probably get a blanket before I flash somebody. Sorry, guys. Already in pajamas. Tommy, you can start talking.
Well, I'm not even sure what we're talking about right now.
We are talking about my diagnosis. Whichever ones.
Whichever ones we have?
Which ones today?
Yeah.
Weighted blanket. Oh, God. I love my weighted blanket, but it's so hard for me to move. Sorry, guys. It's been kind of a long day for me.
Yeah.
It was hot. Very, very hot today. So,
Muggy.
it was really muggy. So I didn't do anything. Tried to stay in the shadows in the camper as much as possible. And we tried to get the other AC working, but it kept popping breakers. So, next project next week is solar panels are coming in. So, I ordered those today. But, anyways, topic at hand tonight. Besides service dog that doesn't want to listen tonight. And his tail.
Super happy tonight for some reason. Super
Yeah.
happy.
He very much is. So, my first diagnosis was actually way back in 2009. I had started having lots of migraines. Bad. I mean, I was on preventatives, I was on everything. I mean, it started when I was in South Carolina. My daughter was about a year and a half old.
Go lay down.
South Carolina was hot and uncomfortable for me. I was pretty much miserable the 11 months I lived down there. But that was where I got the chronic migraines diagnosis. And then that was 2009. In 2013 is when 2012 is when it started escalating. 2012 I went to the hospital with severe abdominal pain. I mean, all of a sudden severe. I mean, and the last time I had honestly felt pain like that was when I found out I was pregnant. So, they at the time couldn't place it. I mean, I think they ended up giving me like Dilaudid or something to like knock me out for 6 hours so that it would go away. But from then on, I was having lots of pain. And I was diagnosed in 2013 with fibromyalgia. And it was sort of doing this. Like, I was going in weird cycles. So, I lived in New England, so, weird cycles, it happens. Somebody with EDS, POTS, neuropathy, temperature intolerance is a huge thing. If it's not like a perfect 70 degrees with the wind blowing and not humid, like, I'm dying. And so, but then, so I thought I was coming out of a cycle. You know, I thought I was doing well. I started pursuing my firefighting career. And I fought through different episodes of things that really couldn't be placed. I actually remember one night in my Fire 2 class, Fire 1, Fire 2, Fire 1, it was all boys. Boys were putting all the chainsaws back together after we had cleaned them and everything. And I literally was looking at two guys in my class standing in the open garage bay door
Lay down.
in the garage, and I'm looking at them and going, if they don't move, they're gonna get thrown up on. I had overheated so badly, I almost passed out.
Now, if anybody has no idea what firefighting is like, you think it's sitting around waiting for the call to come in. No, it's not. She can attest to this when she came to work with me a few years later. I put her through the ringer. You know, she walked in with all these certifications and stuff, and I'm like, okay, prove it. I was a training captain of the department she joined in 2015. Yeah, my voice sucks.
Yeah, well, you were just starting to crack, so I...
Yeah, I have a hard time hearing 25 years of standing with a Q.
A Q is
truck.
the fire siren.
That nice, big, loud, piercing one. Yeah, that was my favorite. But the Firefighter 1, Firefighter 2 class is very physically straining, especially when you're doing your practical days and you're trying to get certified.
Especially when you train with guys who work 24 on, 24 off, and or work for the military and or FDNY. I didn't train in northern New England. I trained in Connecticut. I would say like a good portion of my instructors were working FDNY or at the Marine base. So these guys were really no joke. They're not boondocks, volunteer firefighters, and nothing against them. My hometown was the town actually where Tommy worked when I got hired there. That's a rural department. It's a busy ass rural department. So it wasn't a sit on your butt type of thing. And the guys who trained me put me through the ringer. There were 11 kids in my Fire 1 class. 11 kids. I say kids because most of them were under the drinking age. 11 of us. 4 passed. I was one of 4. So I didn't know what was going on in 2015 besides the fibromyalgia. So I was on a pain med for that. Oh, and at that point they had also diagnosed me with something called interstitial cystitis, which really is probably not truly interstitial cystitis so much anymore as it is a straight up neuropathy, nerve sympathetic system response from my partial orthostatic tachycardia syndrome. But POTS, which is partial orthostatic tachycardia syndrome for short, actually crosses over so many different diagnoses.
It can mimic fibromyalgia, it can mimic MS, it can mimic diabetes, it can mimic Lyme.
Mine mimicked diabetes at one point.
Yeah.
They thought I was diabetic before they ever thought I was...
It can mimic mono. It makes your body do a lot of weird different things. And this was all stuff. I had 20 years experience in EMS, and I had never heard of it until I met her. And we didn't know POTS until sometime later after her and I met. Shortly after she came on the department I worked on, I stayed over one night after my shift ended when she was working, and her and I were talking because she was a new firefighter, and I wanted to get a feel for her and stuff. And, yeah.
It muffles.
It's a bad habit of mine.
Well, because you're talking like you would talk
Right.
to me. I'm talking like there's a mic over there. That's
But that was the first time she told me anytime that, hey, look, there might actually be something that you need to know about. And that was when she told me about this past medical history that she had, and I was like, all right, well, your doctors have cleared you, right? And she's like, well, yeah, and she passed the department physical and everything. So,
And I also was having annual physicals at my department. I was in a combination department in Connecticut that had full-time guys as well as volunteers. All of us went through the same annual physicals. All of us went through the same annual tests. All of that. I was running 400 calls a month, working full-time somewhere else. And I was still running 400 calls a month with my department. People ask me when I slept at that point. Well, I didn't sleep a lot, actually, back then.
now she sleeps quite a bit.
I do sleep
But
quite a bit.
it's not that she wants to sleep, it's that her body's just said, we're done. And it can be 5 minutes after she wakes up.
It has definitely... I have gotten up, walked around, took meds, got in the shower, got out of the shower, and just laid down and passed out for like 4 or 5 hours. Because my body's not ready to... My body didn't get enough sleep over the night to function.
Shortly after her and I started dating,
Mhm.
That was when the
That-
blood sugar issue started.
Yep.
And all of a sudden she would eat and her blood sugar would tank.
I mean, within 20 minutes of eating a decent, healthy meal, I mean, we were recording. I was taking my blood sugar 10 times a day.
Yep.
Because we didn't understand. We're like, this isn't right.
It's not normal.
It's
She
not
would
a
eat
typical
candy
blood
bar.
sugar response.
Give you an idea. She'd eat a Snickers bar, which was one of her favorite candy bars. And you would expect somebody's blood sugar to spike after eating one of those, right? It's all sugar. No. Her blood sugar actually went in the toilet. More than once, it was like, whoa, wait a minute, what is going on here? So,
Again, we got readings where
Yeah.
the docs were like, are you functioning?
Yeah.
I'm like, yeah, I'm walking, like, all of these I took myself.
Her primary care doctor sent her to Dartmouth Hitchcock, and they did what they call the mixed meal test, which is they have you fast, and then they give you high glucose syrups.
They're not high glucose syrups. They're what are basically what almost would come in a feeding tube for somebody.
Yeah.
Because they want to know exactly what your body's taking in. It's like the control. Because they know what a normal body should do given this specific set of nutrients, basically.
So that was the first time that we found out, well, she's not diabetic because the test came back as
Normal.
Normal.
Even though
She tanked.
that day I almost went from upstairs in that lab
Down to the emergency.
down to the emergency room. They had to order my prescription migraine medicine in the lab, and a doctor had to sign off on it before they could even release me because I was in such bad shape.
So one of the things that we learned at that point was they said, look, what's happening is your body's doing this weird thing. We're not too sure what it is. We usually don't see this in women your age, but what's ended up happening is basically your body's shunting all the blood to the core when you eat. And this is what's causing these diabetic symptoms. It's not that your blood sugar's dropping, it's that all your blood's going away. So we're getting a false reading. So that was when we started dealing with the eat smaller meals, smaller portions, more times a day.
Which just turned into me eating less. I
Pretty
eat
much.
1.5 meals a day.
I am honored to eat. Believe me, I am.
He literally makes dinner pretty much every night. He cooks. That's the other thing. I'm so, like I said, I'm temperature intolerant. They don't want me over a stove. They don't want me taking hot showers. I can't go in I go in a hot tub and
She'll die.
I'll
She'll drown. Because she'll pass out and drown.
Yeah.
If she's not with somebody.
Yep.
So that was one of the things that was happening. And then she started complaining about having these weird dizzy spells and bouts of chest pain and stuff like that. Well, prior to her coming back north, she had a Holter monitor and came back normal. A Holter monitor is one of those monitors you wear, and it measures your cardiac output for, well, not your cardiac output, but your heart rhythm. For, it can be 24 hours, it can be 7 days, it can be a month. So
I've worn about 7 months worth.
she came into the fire station one day when I was on duty, and this was after the doctors had put her on medical leave. And she came in and she was like, I'm just not feeling so good. So I brought her up into the office and I grabbed one of the cardiac monitors and I hooked her up. And we did a full 12-lead EKG. And it's normal. I'm like, I don't see anything. There's nothing wrong. Nothing's
But my
jumping out.
presentation was shit.
She looked like she was classic ashen gray, kind of, it wasn't really sweaty, but she was, that clammy skin.
And let me say this. For a female firefighter who has worked to earn the respect of the guys in her station, like, the last thing you want to do is walk in and go, hey, like, it sucked.
Yeah.
But the 2 people that were allowed in the room, I also knew weren't gonna,
Yeah.
It was Kirk and Brett, right?
No, Brett just went and got the ambulance.
Okay.
I called Kirk up because what ended up happening was she bent over to touch something on her ankle. And when she bent over, I watched her cardiac monitor go boom, and her heart rate tanked. You went down to like 30 or 40 or something. And then she sat back up and she's like, oh, that didn't feel
it popped like RSV or PVCs.
Yeah,
or
you were
something?
throwing PV. It was just like, wait a minute. I was like, what?
Please excuse the interruption. There's nothing outside.
Wind blew. So I had her do it again, and she looks at me like, what? Because it was very uncomfortable for her. I'm like, humor me, do it again. And so she did, and sure enough, boom, I caught it. So I called my partner, one of the guys who was working. It wasn't my partner, but
Who's also skilled in reading.
Yeah, he was another advanced EMT such as myself. Very knowledgeable. He was our cardiac guy. He was our go-to cardiac guy. So I called him up and I was like, hey, take a look at this. And he goes, he's looking at her, he's looking at the strip, he's looking at her going, what? And I said, watch. Because the monitor at that point is showing normal sinus rhythm.
Yep.
I had her bend over and I did it again. He goes, yep, we're taking a ride. So we loaded her in the ambulance and took all the 12 leads, go to the local hospital, and they were like, oh, so what's going on? And we went, take a look at that. And they kind of went, oh. And that was when we first started hearing about POTS. And it wasn't at the ER either. It was Dr. Real.
It was Dr. Real. So Dr. Real is an amazing physician.
Primary care doctor.
Who goes out of his way. He sees the day-to-day, elderly, everybody, blah, blah, blah. But I was a challenge for him. And he was willing to take that challenge on. He was willing to listen to me. He understood that I was an EMT. So I understood pre-hospital care, pre-hospital symptoms, signs, what I needed to be telling a doctor. Because as an EMT, I know what I need to give to a doctor when I go take a patient in who can't advocate for themselves. It was about this time Dr. Real did a literal physical exam, and he discovered I was hypermobile. I'm the owl.
So
he calls me an owl.
She can actually tilt her head all the way back and touch the back of her head to her spine. I'm not going to have her do that.
I'm going to do it anyways.
Oh, God.
Scout, watch out.
This could be bad.
My dog's here. Hey, sorry, bud.
Well, you kneeled on him.
I was trying not to.
All right. You don't do it today.
No, I did it.
Yo, yeah, all right, stop.
I want to show them, though.
No, I don't,
Hold on.
because I don't want you falling down.
I'm kneeling.
Yeah, that's...
Oh, my God.
That's not all the way back, by the way. And this is what happens. She's dizzy and nauseous. I don't even have to look at her, and I can tell.
Yeah, and everything from here up feels like that, like all of a sudden that pressure that you get sometimes where it's like,
Boom.
and it's, hi Cinder.
Well, he knew something.
He knew something was wrong. So Cinder's right here. Cinder just creeped up beside me. Scout's already laying on the floor next to me. But Cinder has a pretty good sense too, especially when Tommy reacts to me doing something. So there's that. I can also, my rotation on my head, I go so far around that, like, most people can't see, like, I can actually get, and I'm better on one side than the other. Probably because I actually, when I grew up, I always slept on my stomach. Always, always, always. Literally flat with my head facing to the left. Basically my entire life until I got breast implants. And then I couldn't sleep on my chest anymore. Where's the broom? Where's the short broom?
I threw it out.
Oh. I need bar. I need a bar.
Wow.
Oh, I can use that. Alright, keep talking about the diagnosis that Dr. Real, and then, and then the neuropathy too.
Yeah, Dr. Real was like, there's certain things we need to do. So,
hypermobile.
She was hypermobile, so then he sent her to a neurologist who, let's see, for lack of a better term, I won't say it was incompetence.
He did diagnose me, and he did
diagnose you with a small fiber neuropathy. But the methods in which he used to do that, I feel, while they might be sound under medical practice, he put her at risk. He had her stop taking medication before she went into the tilt table test up in Dartmouth.
Which I've had multiple.
Yeah.
So, one of the things with hypermobility syndrome, so once Dr. Real figured out that I was hypermobile, it's called hypermobility syndrome, or HEDS, depending on how they classify it. EDS is Ehlers-Danlos syndrome. And
that affects the connective tissues.
It does.
Makes them very
you have
skinny.
a collagen mutation. I have a collagen mutation. And basically there's 6 different classifications and they all kind of cross over. So one of the things he had to do immediately was they had me do a stress test as well as a resting echo to make sure I didn't have an aortic distension. Distension?
They wanted to make sure you didn't have an aneurysm. They wanted to make sure that you didn't have, because on a stethoscope they could hear the clicking of a mitral valve prolapse, but on the echo it didn't show up.
No, but it was a resting echo. It wasn't.
It wasn't a working echo. A stress echo.
I gotta sit up. Let me get off of these.
All right.
I won't try to stand up from here because I'll just
fall right down. So she's had, over the years, she's had 3 tilt table tests.
Oh, because Vanderbilt did one now too.
Vanderbilt just did one.
So I've had tilt table tests at Dartmouth Hitchcock Medical Center up in Lebanon, New Hampshire. I have had a second tilt table test at Boston Medical Center.
By the guys who actually designed the test and wrote the actual protocol for
and
it.
developed the entire department for Boston Medical Center.
And they actually,
In
that one, it wasn't, you weren't in there 5 minutes and they stopped the test and the doctor goes, that's textbook. You're now a case study. You are now going to be a classroom discussion in my
I
lectures.
will be patient Y in his instruction for his medical students. I was such a I went from what they called borderline to textbook in about 18 months. And this is the same time I'm sliding downhill. Like, I think at this point, we're going through meds, we're doing all sorts of things. At one point, one med I was on zonked me out like 18 hours a day.
Yep. She has a first-degree heart block. That was one of the things we found with the 12 lead that day was.
Yep. An AV block.
She does have an AV block, which, contrary to medical science, causes chest pain. Well, cardiologists are like, oh, first-degree heart block's not going to cause chest pain. And look, I've been in medicine long enough that everybody's different. Every patient is different, especially women. Women have different cardiac signs than men. It's just a fact.
It's known because women might present as nothing more than rear shoulder pain, and they could be having a heart attack.
Yeah. I've had females with toothaches, shoulder pain, wrist pain, believe it or not, ankle pain. And it was all cardiac related. They don't have the classic crushing chest pain radiating down the left arm. If a woman has that and she told me that, I'd be kind of skeptical. I wouldn't discount it. I'd check it and make sure she wasn't. But I'd be skeptical. If she tells me, yeah, I feel fine, but I have this toothache, I'm going to be really kind of looking. Anyway, I digress. She's tried several different heart medications. Propranolol, atenolol.
Yep.
Diltiazem.
Diltiazem. I'm on guanfacine now as basically a suppressant for my sympathetic response system. Because POTS is essentially an overreaction of your nervous system. It mimics so many things, but when they run all the tests, there's nothing there. Because it's a nervous system response. So unless you're doing these specific tests known for POTS, it's not going to show up like you think, because typically a doctor isn't thinking that way.
Nope.
I had a third tilt table test down here at Vanderbilt in Tennessee. This group, the autonomic disorders group at Vanderbilt, has been amazing so far. I called them and they were literally able to get me in with a nurse practitioner the next day.
Yeah. They were like, how soon can you get here?
I called them and I said, look, I am a critical care patient. I have POTS. I've been diagnosed with POTS, neuropathy, and EDS, among other things. Because I literally, there are so many things I forget. I forget to tell doctors, and I can forget the EDS sometimes, because the POTS is the worst. Even though it could be from my EDS, which we haven't gone down the road of figuring out which yet, because well, the geneticist at Boston Medical Center just kind of...
She didn't want no part of it.
She didn't want any part of it. And that did upset me. But the autonomic disorders team at Vanderbilt is a group of doctors from different specialties. And I was also able to see Dr. Muldowney, who is the lead, the department head for this team, which has been amazing. I can communicate with him on the portal and all that, and it's wonderful. They were even amazing enough, so I was actually scheduled to have my last tilt table test in February when the really bad ice storms basically swept the East Coast and everything down here, nothing was plowed. I mean, they called the night before and were like, look, we know you live far away. If you want to reschedule, we're willing to reschedule you the same day that you're supposed to meet with Dr. Muldowney. So you'll have your test, we can give you a lunch break,
yep,
and then you can meet with him. That way I had some time to recover from the test, which I really, really appreciated. It's little things like that that somebody like me actually, like, that's a big fucking deal. Because I didn't feel great after the test. And I did need time to recover in order to be able to have all my cognitive abilities. Like, see, I'm talking a lot more right now because I'm starting to recover from doing the neck bend thing. But you see, if you go back, he started talking because I was slowing, my brain process slows down.
So that's something else that someone that has this kind of disorder is going to have. It's going to affect their mental ability. And it's not that it's going to make them crazy or anything like that. They're going to feel like they're going crazy. But it causes depression. It causes post-traumatic stress. It causes critical thinking skills become more complicated. It's
Brain
like,
fog is awful.
it's like watching a patient with a neurodeficit of some sort. Not so much Alzheimer's or dementia or anything like that. It's a cognitive problem. The synapses in the brain aren't firing and connecting the way they should.
Because my brain's not getting enough oxygen. Because of my POTS.
Which can turn around, and then when she stabilizes, it then causes this emotional rush. And it can be either crying, laughing, screaming, a combination of all of the above.
There's actually what they call involuntary emotional response. This morning when I woke up, I was an absolute basket case. I mean, I was blubbering. I literally was like, just leave me alone today. Please just leave me alone.
And it was just, she woke up. Nothing else had happened at that point today.
I was screaming at dogs first, like...
Oh, she was screaming at the dog. She was screaming at the guinea hens outside. I got yelled at. And I know a lot of the times when I get yelled at, it's not that I've done anything. It's just that whatever is going on, she knows she's safe with me. I know 99% of the time it's not me. Doesn't make it any easier sometimes because it's toll for everybody.
And it makes me feel awful.
And then she feels 10 times worse because it's like she's not trying to make me feel like crap. It's that she has no control over us. It rewires the way in which her brain processes thoughts and stuff like that and emotions. And
in certain scenarios.
It can, that in and of itself, if somebody's not familiar with the symptoms, the signs and symptoms, and how these patients deal with everyday life, they're going to think, oh, what the hell is this person's problem? Why is she being a complete and total witch and all this other stuff? And they're not trying to be. Believe it or not, and sometimes they have no control over it.
We currently live on my sister's 50 acres farm here in Tennessee. And we've been here since August of 2020 because of COVID. When COVID hit, I was actually in the Dallas area trying to see a pot specialist down there who has his whole own facility, where I would have been under the care of his physical therapist through an 8-month program that is meant to build my body back up and literally train my body to overcome the response before it happens.
Thank you, COVID. You screwed that one up for me.
That was a hard one for me. That was a hard one for a while until I realized that Vanderbilt had a very good program. The end of 2020 was hard for me because I couldn't see the path forward medically for me.
She thought she was at a dead end. This was it. This is the worst. This is it. There's no help out there, no nothing.
Like the last chance, I felt like the last chance I had been ripped out of my hands. So. Great, COVID's going on in the rest of the world. What about me? I'm sitting here dying. Not literally dying because I get as close to death as you can come without actually dying on a regular basis. I mean, literally, I have had those, and I will never, ever wish this upon anybody, but the feeling like you're going to die, and then you're literally circling the drain in that moment. You're not suicidal, anything like that. Like, you literally feel like you're dying. When my heart rate skyrockets from the POTS, or tanks out from the POTS and the AV block, and I go bradycardic, I literally am dying.
Or at least it feels that way. Because it becomes very heavy in her chest.
It's the
It's
oxygen
difficult.
deprivation.
It feels like she can't breathe. And I'll check her heart rate. And sometimes her heart rate is, if she stays anywhere between 66 and 88 beats a minute, that's her happy place. Right in
That's
there.
about it.
That's it. Anything below 66, she starts to have the chest pain and the difficulty breathing.
Last night? Night before?
Both nights. And then if it goes above and she starts to go tachycardic, it will cause the chest pain. I'm not really so certain you have the difficulty breathing when it's rapid, but it's definitely, it increases
No,
your
it
chest
was
pain.
rapid the other night when it happened.
Yeah, because
It doesn't, when I go bradycardic, it's more, so when I go Brady, the best way I can describe it to people is drunk spins. That feeling like you need to hold onto the grass outside on your front lawn because you're so drunk the whole world's spinning. That's the feeling I get when I go bradycardic. And I'll look at him and go, I have to lay down. I could be sitting here lean back like this watching TV. And all of a sudden, I go from a normal 70, 75 beats per minute to 40.
Mm-hmm. She didn't do anything. It just, or decides she's going to slow down.
And my world, and literally, when in those moments when I tell him I have to lay down, there is no in between.
It's now.
It's, I have to lay down now. And as soon as my head hits that pillow, 99.9% of the time, I pass out faster than a fucking baby that hasn't taken a nap in 16 hours. And if I'm lucky, I'll sleep 3 hours and I'll wake up and I'll actually feel kinda okay for 5 minutes.
You or I go and, say we ride a bike or go for a run, or, you're doing physical activity, your heart rate goes up. That's normal, right? Not for somebody like her. She does activity, her heart rate goes down.
I can be rowing at full bore on a rowing machine and my heart rate will be going down, not up. Kid you not, the physical therapists have seen it.
I've seen it.
It scared the hell out of one of my physical therapists one day, and she was actually a PT who had been trained in POTS. She had actually done a fellowship in another facility that under another experienced physical therapist to do a whole fellowship on POTS. So she was familiar with it, and my body was even acting more out of the ordinary than what she was used to seeing. I was on a recumbent bike she was standing right next to me one day. She's literally monitoring my pulse ox. I had pulse ox on the entire time. So she has me pedal for like 3 minutes, and then she tells me to stop. Because she wants to see what my heart's doing. Stop. I'm just sitting there talking to her, kind of doing this with my hands, and she's like, stop talking. And she's looking at the pulse ox. Now, this is medical grade. This isn't $35 I bought it at Walgreens. And she's watching it, and she's like, I need a nurse. I need a nurse. Apparently, my heart rate had jumped to like 200 beats per minute after I stopped pedaling. It continued to rise, and I'm like, I'm okay. And she's like, I don't think you are. And I'm like, I'll be okay.
And then just like that, she'll go back to a normal rhythm. It's not like it gradually comes down. It's just all of a sudden, she'll go from boom, 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 boom. Oh, we're back in 72 beats a minute.
Oh, okay. Now this substernal chest pain you have is starting to dull out. Because at this point, now that I've had that, it will be sore. It will literally feel like the inside of my chest cavity has been bruised. Which it probably has. So one of the other things I have is basically
Concave sternum.
A concave sternum. And it's, according to doctors, it's pretty severe. And in my brain, that makes me think my heart, when it spazzes out, is literally hitting my chest wall.
Yeah, the cardiologists have said that as a possibility.
Yep.
Short of opening her up to watch it, we're not going to be able to find out for sure. But
there are a number of tests we can pursue with the geneticist here at Vanderbilt now, to see if I have another connective tissue issue as well, because EDS in itself is one of like 22 connective tissue disorders that can kind of cross over each other. But again, I am so super mobile, hypermobile. I can touch. Here, now you're gonna have to. Here, let's pause this. Don't mind my busted up legs. That's actually part of the POTS issue. My skin has become terrible. So.
yeah, the backs of her knees are touching. Like, it's not the sides. Those are the backs of her knees.
Yeah. So there's that.
You alright?
Yep.
See? This is what happens.
So, in doing that, one of the things I did is I constricted all of my muscles in my legs. So what that did is shunt a bunch of blood back. It forced a bunch of blood back up into my core, which just made my whole equilibrium go all wacky. Now, I don't fall into a typical EDS category because I don't fit all of their... I am on the edge of their Beighton scale to grade it, but they don't measure hypermobility in all of the things I am hypermobile in. So, like, my neck, my spine, I literally, they've already told me, I compress my spinal cord when I tilt my head back. Because my vertebrae are literally doing this. Basically folding back down, almost done. I have early degradation in my lower neck. Actually, because of living my life, all my life that way. I never knew until I was in my 30s. Now this one that I'm going to show you, I have known since I was in high school. I was in a gymnastics class. We were all told to lay on our stomachs. We all got the dowels out, and they're like, oh, you're basically basically do the Superman. So you put your arms up like this, and it's basically stretching your biceps, your triceps, things like that. Well, make sure I don't knock anything over. You can see that my hands are, like, next to my body. Oh, I might have to get down on my knees to do this one. Alright, so my hands are still next to my body. Straight out.
Yeah.
Let me tell you, when EMTs see that,
They freak.
I have made grown men squirm like they just watched a child puke and eat their own shit. Hi, Mark.
Yep.
Oh, this one too. So, vertically, if you drew a straight line where my spine would be straight down, my knees actually go out farther back than they're supposed to. Like, I literally lock a leg in the shower. If I need him, and if I've called for help, and it's happened.
Yeah.
It happened the other day. I got so winded all of a sudden in the shower, like I couldn't breathe.
No, yesterday.
And he had to help me out of the shower and stuff.